Hi, this is Ashley.
And this is Megan, and we are the Mito podcast. So we're coming to you today to talk about the UMDF yesterday did a Ask the Mito Doc call, and they talked strictly about COVID and the coronavirus. So we're going to talk a little bit about that since it pertains to everything that's happening right now. And I took some notes on the call, and then we're also going to post a link to the call. It's recorded, so if you want to go back and listen to it and you have any questions or anything like that, you can do that through the UMDF website as well.
And also, just to let all of our listeners know, we are doing this podcast from our own homes, so we are not in the same room. We're trying this out for the first time and see how it goes. But we're respecting that social distancing, something that we're familiar with, but we haven't had to combat with this podcast yet. So hopefully everything will go smooth and you can hear everything. And if not, let us know.
Exactly. Yes, this is a virtual experience, our first. So just introducing it, so they had 4 doctors, which if you've ever been to the symposiums or anything like that, they're 4 of the top specialists. It's Dr. Goldstein, Dr. Cohen, Dr. Kendall, and Dr. Parikh. And so they kind of went back and forth and just talked about some of their different views on certain questions. It's all about questions that the audience posed to them. And I think one of the things to just stress, first of all, is that they really just said, that this is such an unknown virus. It's something that obviously has not been around before, and so they don't have a lot of information. There's not a lot of data about it. There's obviously not any research on it, except for what we're getting from the other countries and how their people have actually been handling the virus. So I think the first thing is actually one of the questions that, oh yes. Yeah.
Sorry. Actually, I think I'll just raise my hand every time so you know.
Yeah, I can see you. I can see you.
So one thing I think is interesting about COVID-19 being a virus that we don't know much about is that we can kind of relate to that, because Mito is something that still a lot of people don't know about, and we have to rely on our counterparts in different countries and research from different countries. We have to kind of all work together to figure this out, which is the same thing that we have to do for mitochondrial diseases, right?
That's true. I didn't even think about that. But yeah, that's exactly it. Just having something so unknown and just trying to look at how other Mito patients react. Right now, they said there aren't any Mito patients in the US, at least, that have contracted the virus. So they don't know particularly how this is going to affect Mito. But like you said, there's so many unknowns about Mito in general that, even if one person had it and, had certain symptoms, it might affect somebody totally different. So, but I think the first thing they wanted to stress is that if for some reason a Mito patient does contract it, and this is a child or an adult, they just pretty much said it's kind of the same thing. It really just needs to be treated like how we treat every illness. It's very much like if a Mito patient got the flu or something like that, that you need to do the things that you would normally do when you actually get ill. And they also said it really depends, because Mito is so all over the place with, whether you have different, which organ systems are actually affected by your Mito, or how you react personally to getting ill. Some people that have Mito, having a cold or having the flu maybe doesn't affect them as much as someone else, like my son. So it really right now, all they're saying is just to do what you would normally do if you actually got sick. So I think that's important. They did say if you are someone that has leaves, which we've talked about before, just because that seems to be a more severe form of mitochondrial disease, that one of the things that they would definitely suggest is if you do have to go into the hospital, and usually someone with leaves probably would. Once again, I'm not a doctor, I'm just relaying the information, but just the intravenous fluids and things like that are really, really helpful. So they were highly concerned about most Mito patients, but they definitely at the beginning stressed if you are a Leig's disease patient that it is more likely that you will be seriously affected just because you're more affected with Mito at that point. I guess I would say that may not be saying it correct.
Right.
Yeah. And then, so they were also really stressing about how dangerous it is to go to the ER, right? We're thinking, that all these patients are, going to the emergency room. And if you go there and say you don't have coronavirus, you might be exposed to it. So they were saying that definitely that you need to really think about your symptoms. They said if you can't control a fever at home, if you have difficulty breathing, those things, if you are somebody that's vomiting and has diarrhea, which apparently is some of the symptoms as well, and you can't control keeping down fluids, that those are things that are of great concern that you might need to take yourself to the emergency room. But if you're someone that tolerates illness, or you have the cough that everybody's talking about, but you're still breathing okay, that going to the ER isn't necessarily the best place if you have Mito, unless your symptoms are much more severe. And they said that one of the other important things is that the Mito patients that are going to be more susceptible are the ones that have Mito and are immunocompromised, that have broad system complications, that have trouble with hydration. So more patients that are tube fed or are TPN, and then just overall Mito patients that are more frail medically, or if you have Mito and diabetes. Apparently diabetes is one of the big diseases that is definitely being affected by this. So if those are kind of your situation, those are things that they said they would be more concerned about if you did catch the coronavirus or COVID-19. So that was definitely eye-opening. I mean, I know we see this all the time, and a lot of our kids are immunocompromised, or, the adults, and have multi-system issues. So, we know that this is definitely not going to be our friend. So we're just, taking as many precautions as you can.
And I think it's hard, and I know that a lot of us already know what it feels like to, I know we were talking about making this into 2 podcasts, but maybe we should just do one.
Just go through one.
It's hard. Quarantining is hard. I think the day that you get your diagnosis, all these thoughts go through your head that you are not familiar with, and I think the whole world at this point is having those thoughts. And they're not, I can't say the whole world is necessarily exactly in our shoes, but they're getting a small taste of it. And 2 things. One, if you have a Mito family member, hydration is so important. It's more difficult for someone with Mito to keep hydrated than I think it is for a different, or for other people. Mm-hmm. So constantly push fluids, even if that means, I was just talking to Christina the other day, and she was saying how she was making the girls drink more and more water and keeping them hydrated, and how many diapers that they're going through. And I know that is going to be hard for a lot of people, because you rely on those diapers because insurance pays for them. The older your child gets, that's something that insurance takes care of. But that means that you're also not getting a constant flow of diapers too. Mm-hmm. And just with everyone at this point, with keeping things in stock and going to the grocery store and buying up stuff, remember that there's children and adults who need those supplies that might not be able to get them now. Mm-hmm. Not that they weren't stocked before, but now you're going through them so much quicker.
Yeah, exactly.
And I already forgot my second point, so.
That's okay. Well, hopefully you'll remember, and I'll talk about what they said a little bit for precautions. So They were pretty adamant about if you had Mito that you absolutely should self-isolate. They said no going to the grocery store, no going out to pick up things, to utilize online services and family and friends that can, pick up things for you. And they said, which, like you said, we are so familiar with a lot of this stuff, not necessarily not going to the grocery store, but that's a little bit of a change, I think. But anything that comes into your house, wiping it down with Clorox, and just making sure you're washing your hands and doing all of that. And those are very much things that we've always done.
Actually, that was my second point, was that as Mito families, even though that you're used to this, for the families that, so I guess what I'm trying to say is, even if you directly, if someone's listening to this and you don't have someone in your household that has Mito, but you know someone that does, you have to keep in mind that they are even more quarantined than they were before. They cannot see everybody. There's a very selective few that should be allowed into the household just for precaution wise. It's not saying that they don't want you there. It's not saying that they don't want your help. It's that they can't have it. Mm-hmm. And they're trying to protect their child or their family member. And it's really hard to tell your mom or your dad, no, you can't come over, or a friend, no, you can't come over. We were in that position a few times when we had Angie, and it was horrible. It was horrible to have to tell somebody no, or if you traveled from far away, not being allowed in the house, like, it sucks.
Yeah.
Please try to not put those people in that position to where they have to question it or that they have to tell you no, because it's so uncomfortable. And everybody is going through so much right now that that's just one aspect that we can take away. Does that make sense?
Yeah, no, absolutely. I mean, it's usually we're very much like, oh, okay, well, if you're sick, and all our friends and family know if you're sick, absolutely stay away. But now it's like, it doesn't matter. It doesn't matter if you're sick. It matters, but I'm saying now it's everybody. I know my parents were wanting to come down for Easter, and, I'm like, Mom, no, it's, you guys have to drive down here, you make stops, you expose yourself, much more than we do. And it's, you don't like saying no, and it does make you feel awkward. I had a few situations with Troy's birthday, where you want people to be there, but it's like, you feel, no matter how many times and how I think I'm just protecting my child's life, and nobody else really understands unless they live this life, but it does, it does hurt us. It does make us feel bad when we have to say no to people or, cancel things. But yet we've been doing this for a long time. But it's just now it's like, it doesn't even matter if you're healthy. It's just, you can't come in. I mean, we have people, my husband's parents dropping off, groceries and things, and they drop them off in our garage and we wave from the window, and, it's like, we just can't take any chances. It's our Mito, whether it's your child or your husband or brother, sister, whatever, it's their lives. It depends on this stuff. And it's very hard. And we just hope that, people understand. And sometimes I'm very like, well, if they don't, I'm hurting because I had to tell you no. So if you don't understand, I don't know what else, you don't know what else to do.
Yeah.
So yeah, it is a little different this time, but we have had to do that kind of thing for a long time.
Yeah. So I think it's just important for people to understand, be respectful, and some people might not have the courage or the strength to tell you no, and they might open their home up to you, and that also is going to feel pretty crummy because they're going to be on this moral part of that of life where they feel guilty for letting you in. Mm-hmm. And it's not to say for everybody, but just keep mindful of it. Even if someone tells you yes, think about it again.
Yeah.
Because they might just not have the courage to tell you no.
Exactly. Yeah. And one of the things that they were talking about on the webcast was because some people have, healthcare workers that actually come in and help to take care of, the Mito patients. And that's, something that how do you handle that? Because it's necessary. It's a necessary need. And they were just talking about that you just have to make sure that you remind that person if they have any symptoms, or washing their hands before they touch anything. But it's taking a chance no matter what. But there are going to be situations where healthcare workers come in, or sometimes there are situations where parents have to work and they have to leave the home. And one of the doctors was saying how he literally changes his clothes out in the garage, gets completely naked, washes his hands outside, does the Clorox wipes, leaves his clothes in a bag. And he says he tells his kids to close his eyes, and he runs through the house and takes a shower, So, there are going to be situations where, families are doing the best they can, but they still have to somehow go outside of the house. And, you just have to be very careful, because they were talking about how the virus will live on clothes and surfaces and, any shipping packages and things. So, we just have to go from level 10 to level 100 right now with just being safe.
I have so many boxes sitting on my front porch right now.
So do we. When Tony ordered some popcorn, and it's sitting out there, and I'm like, it's probably pretty good for 2 more days. We don't need the popcorn right now.
I have like a box of gloves that I've had since Angie, and most of the time I just go and grab one of those, rip it open, throw the package out, and grab what's inside.
Yeah, that's what we've been doing too. So it's,
and depending on what it is, it might just go straight into the garage instead of in the house.
Yeah, if it's not needed. But the webcast was, it was very informative, but it just they came back around to the fact that, they just really don't know a lot about this virus right now. And they're saying that even though, the regular population may be told that it's, safe to come out of quarantine or isolation, they said for the Mito population, it's going to be, months after that. And we all know, because we're more vulnerable, and until there's a vaccine or an antiviral drug or something like that, we're still, not going to want our Mito patients to contract this virus. So it's going to be a long haul, but we all do what we have to do to keep our families safe and healthy. So
yeah.
But I can definitely say, when coming from a parent, that I think we have this stress all the time, especially flu season. It's like you have flu season that goes by, and, it gets to March and April where it starts to decline, and you're like, yes, we can start, doing a few more things. And now it's like this came around and we're even a more lockdown, which the lockdown doesn't bother me. It's just really the stress of worrying about whether or not my son Troy would, he would get the disease, or what would happen. And it's just, I will be honest, the first probably week or 2, I was so stressed out that I was probably making myself sick in a sense. Like my body was aching, and I just, with all the media and the news, and just so worried. It's really hard, because we already have this level of worry every day, and now it's just really heightened. So I think that's another thing that they kind of talked about in the webcast too, that, do the best you can, and we have to stay calm and, do what we're doing. And it's just, it really is not being bombarded by the news or the media, and maybe limiting that if it's something that's really affecting you, and just, trying to spend this time with your family, and just hoping that things are going to turn out, the best. And then, if somebody does get the virus, taking the actions that, to take. And they did say that, one of the things that they talked about was doctor's appointments. People were really worried about a lot of the doctor appointments that they have scheduled. And they said that a lot of the doctors are doing teleconferencing. So they said, unless your doctor's appointment is like medically crucial, they said to just call your doctor and see that if you can, do a video conference or even a phone conference with them over the phone. And that is what they're recommending right now. I mean, obviously, if you had something happen that you actually had to get to the doctor in the hospital, that's one thing. But if it's not crucial, they said to definitely call your doctor and see if there's another way that you can keep that appointment or reschedule. So, and that's what we've done with a lot of Troy's things.
Going back just touching on what you were saying about people coming into the home medically, like therapists or educators. I know for a lot of families that's pretty much stopped, or excuse me, a lot of Mito families that's stopped because, well, for numerous reasons, but I can say that when for Angie, and I know not everyone has this ability to do so, but I bought everything that we needed, or I made what we needed, and I only had our therapists and educators use those items unless there was something that I couldn't buy. But we made sure that every toy was wiped down before Angie touched it, because you don't know with with uh, with that profession, you're seeing so many different families in a day, and you don't know how, like going back to like this virus, you don't know who's been in contact with who or with what, and so all of those items would have to be completely wiped down. But now it is scary to think about all of those services not being that you can't use those services right now. One being you might lose them, I'm sure, for some people, because if you're not actively using that resource, they'll take it away from you. And two, it gives the parent a break sometimes, even if it's just 30 minutes or an hour. And I don't mean like it's your time to go do you, because, but like with Angie, I would
laundry.
well, I would sit with Angie like through every single lesson and every single therapy session, but it was really nice to interact with that other person with her.
Oh, that's true.
I didn't have to leave her, but it was just nice to have a change with somebody. And I'm sure Angie would get like bored of me too. I always felt bad for her, because I'm like, I'm sure you do not want to see my mug anymore. You're with me 24/7.
I know. Well, that's funny because Troy does have a teacher that comes into the home, and obviously that's not happening right now. So mom is now teacher, which a lot of parents are having to do, which has nothing to do with having a Mito child. And so it's very funny. At first I was not sure if it would work out, if he would just, not really want to do some of the lessons and things with me, but he's actually been doing really well. But you see so many of those funny memes where, parents, I saw the funniest one today that actually Christina posted that had to do with a mom walking out and taking off her, like, my child is amazing, is an amazing student bumper sticker off of her car. And it was day 4 of homeschooling. It's definitely, this is a challenge for parents to have to step into these roles. And granted, I'm a teacher, so, it's a little more natural for me, but I taught middle school, not not elementary. But they also said on the webinar, not to beat yourself up, to do the best that you can with your kids. And this is just such a different time that you just do the best that you can. But a lot of, homeschooling is going on right now. And, like you said, before, for me, that was the time that I would definitely get some things done. Because if I was sitting with Troy and his teacher, I was such a distraction. So I always had to be in another room listening. But yeah, it's that break or that interaction with somebody else. And so, that's going to be missed. And, for some of our kids that get therapies and things like that, it's like that is so important. And, they're not getting that right now. So it's really, up to the parents. And so just for parents to just take it day by day and do the best that you can, keep your kid healthy, and they will come back from this. It's just trying to keep your child healthy. So,
Right.
Yeah. So I even, we have a mutual friend, and she was talking about, her 2 boys are autistic, and the different therapies and things, and just the schedules. And, I've seen all the things that they're posting and trying to do school, and it's amazing what parents can do. They, when you need to step up for your child,
You do, and you adapt. I think going back to what I said earlier, when you first get that that diagnosis, and you realize all of the things that you can't have anymore or that you can't do, which is what I think everyone is experiencing regardless of having a mito child. But you figure it out. You fill those shoes, and you can do this. You will do this. You don't have a choice. That's your child. And that you, like you said, that they commented, like, you just do the best that you can and don't be hard on yourself. And that's not easy. You're always going to have that voice in the back of your head telling you that you've done horrible, or you could do so much better, or whatever. But you just do what you can. And if you feel at the end of the day it could have gone better tomorrow, that's what you do. You figure it out. Go on Pinterest, talk to other parents, or someone. Like, everybody knows it's within their circles at least one teacher. And there's got to be resources out there for you. And Mito wise, there are a lot of great resources. You just have to find them, both with therapy and I lost my train of thought.
Well, with lots of things, like you were saying,
Education. Sorry.
Education, and people are actually doing. I mean, I have a lot of teachers in my inner circle, but people are out there and they're sharing information. I mean, they have the museums that are doing virtual tours, and I mean, there's so many links that I keep seeing online that people are just really trying to come together to give parents different things that their kids can do while they're at home, and to help them with the schooling and different things. So, I mean, I'm even enjoying all the musicians that are playing their concerts live, from their little home studio. It's like, tune in at 4:00 today. And it's like, there's so much going on right now that even though, we're having to make these different sacrifices that maybe we haven't made before, that there's just a lot of different outlets and people that are stepping up to help. So it's pretty interesting and amazing.
Yeah, I agree.
Yeah.
Was there anything else on the call that you thought would be?
Let me look at my notes here. They did say one thing about testing. I know that we're in San Diego and we have a couple of places that are doing the drive-through testing, which is kind of random, but it was at the end of my notes. But it said that if you can not go to an emergency room to get tested, just to limit your exposure, that definitely to try and get it at one of the drive-up testing, just to make sure, because if you don't have it and you go into the emergency room, that you are more likely to be exposed to it.
Right.
So that was one of the things.
One thing I didn't. So to clarify, I didn't listen to the call because I wanted to be able to talk on this podcast without any knowledge about what was going on, so that I could ask questions that may pop up to someone who's listening to our podcast. But one thing to add that I don't know if this was mentioned or not, but if you have a Mito family member and they do start to have any symptoms of something that's irregular for them, call ahead of time to the ER and speak to a nurse and a doctor first before you head over there. One reason is just to explain the symptoms, and two, they will most likely let you go in without having to sit in the ER. You could go straight into a room and not be exposed to other people. When it's very ironic that this is all happening right now, because this is
here we go. We said we couldn't do a podcast without this, so
this is the exact time that we lost Angie. And we're coming up on our 1 year without her. And it's so hard to say anniversary because it's not happy.
Yeah.
I don't know another phrase or word to use for it, but this is what happened to us last year. And it's just so weird because it was literally almost to the day. Because Angie, we went in at night on March 16th and March 17th, we were in the ICU under isolation because of the flu from last year. And it's just crazy. But at the same time, if this could come at any time in the year, I'm actually very thankful that it's happening right now, because it is so much easier to handle emotions and life being at home and working from home than having to be in an office. And I know I'm not surrounded by a lot of people when I'm in the office, but it's very difficult to like look at her pictures that are all hanging up, and you go through your moments where it just hits you. And I'm just really glad that I get to be home right now. And maybe this could be like a annual thing where I just take this 2 to 2 off.
There you go. It's the Angie vacation.
Yeah. Angie's quarantine.
Yeah.
But so we called ahead of time to the hospital and we talked to the doctor. And so by the time we got there was some confusion when we got in, even though we had a letter stating we can't be in the in the waiting room. But they were still quick about it. I've been in ER waiting rooms, and we were maybe there for 15 minutes. And so that was quick in relation to the hours that you could be waiting. But definitely call ahead, let them know that you're coming, let them know what's going on and that your child or family member has Mito and that they cannot wait. And usually a doctor will side with you, and you'll be able to be in an isolated room away from people.
And I'm so glad you brought that up, because they did mention that. They mentioned calling your specialist and having them call the doctor, or or having them call the ER or your pediatrician, whoever deals with you. But that's good too. Just calling the emergency room directly and letting them know, because I'm sure, especially right now, I know we're not at any sort of heightened point with this virus, but letting them know so they can do the best that they can to make sure that if you have Mito or your child has Mito, that you're not exposed to. They said that they're seeing a lot in emergency rooms where they're separating them, to where if you have a fever or a cough, they're literally isolating those people, and even just the waiting room. And then they're having the people that don't have that type of emergency on the other side, which is better. But still with Mito, I know, the few times that Troy's been to the emergency room, and it was, earlier in his lifetime, thank goodness, but we didn't know what to do, but we knew that he couldn't be exposed. So, I would just have whoever was with me wait outside with him, but they had to actually see him where you registered. So we would always have to bring him in. And, I was always adamant about he has to be in his own room. And most of the time we didn't have too many issues. I think once this virus really gets going, that might be a little bit more difficult for the hospitals, but it is always worth you advocating for your child or, your family member they need this. This is necessary. We are the medically fragile. We are the ones that this is going to, unfortunately, be much more complicated than just the normal person, healthy person. So.
And one more thing to add before we sign off. Every Mito patient should have a ER letter. If you don't know what I'm talking about, you need to talk to your doctor. Email them immediately, call them, do what you need to contact them. You need to have a letter from them, from your specialist, that says exactly what Megan and I are talking about. If you don't have one, I'm sure you can Google examples. I know that both of us had one and have multiple copies.
Yes.
I know it's hard to have a go bag, but maybe keep one in your glove box. Put one in your purse, put one on your wall. Always have it on you 100% of the time. If you have a baby bag, put it in there. The letter will state that your child's name, what mitochondrial disease that they have, and that they cannot wait for to be serviced at a hospital or in the emergency room, and that they need to be seen right away.
Mm-hmm. Yeah, it usually, and to be honest, it's so interesting because until we all came together and started talking about, I don't know, the Mito Moms on the Facebook, I didn't have an emergency letter for Troy until his last year, and he's 12. I didn't know about that. And, you think you're getting all your ducks in a row all the time, but it was something that I didn't have. And I immediately emailed his mitochondrial metabolic doctor, and they sent me one, and I have it in every glove compartment of anybody that comes into contact with Troy. I have it in my purse. It's in his little backpack that we take with us everywhere. And it, because you never know when something could possibly happen. And that's really important. And I didn't even know about having something like that. It was just more me yelling out everything. He has this, and this is what we need, and this is what we have to do, and this is his doctors. And that makes it much easier, especially in those situations where you're in the ER. It's not about being, you're not calm, you're stressed, you're worried. And if you have it all right there in a letter, it makes it so much easier, and it spells it out for the doctors. So that is, definitely good advice. Yeah.
Well, if anyone has any questions, or if you have any comments, if you have any ideas for future podcasts, please reach out to us. You can email us at mitopodcast@gmail.com. You can find us on Facebook for Mito Podcast, as well as Instagram.
Yes. And we will put a link to the Mito Doc, what we just talked about with the COVID-19, so that you can listen to the whole thing yourself. It's about an hour and a half long. And then the UMDF is a great website as well for any information regarding this. They're updating things. They said every couple days things are changing, so they're keeping it updated. So thank you so much for listening to us, and we will be coming to you virtually again very soon.
Yeah, stay safe and healthy.
Yes. Thank you. Bye-bye.